I'm Arnold. I'm one of the research fellows here at Hammersmith Hospital, and my role's been partly involved in setting up virtual working for us. The rationale for working virtually is mainly for two reasons. The first reason is that you've got a mixture of confirmed and suspected COVID patients and a group of patients with a low likelihood of COVID, all mixed together in the first phases of the COVID wave. And so if you've got large ward round teams, you're increasing your chance of transmitting from COVID patients to non-COVID patients. And of course, we have healthcare workers who seem to have a higher risk of getting a severe manifestation of COVID-19. This could be for a multitude of reasons, but if we can keep them out of contact with COVID patients with virtual working, that's all the better. So we combine electronic patient records with video conferencing software to perform virtual ward rounds. Our electronic patient records is Cerner, which many of you will already be familiar with. Now, this allows us to do prescribing, documentation, and check results all through the software. So that allows a lot of remote working. Other versions of this software or other licenses and other different kinds of software don't have quite the same level of functionality sometimes, but you can always make it work with what you have. We then combine this with video conferencing software. And again, there are differences depending on which software you're using, as well as which hardware you're using. So we use a setup with tablets using Microsoft Teams, which we've found very useful. You can use software, but the restrictions placed can be different. And so it's just to be liaising closely with your IT team, really. So the most important slide is really this one. These are the principles of working virtually. The most important one is to ensure that there is no movement between the clinical areas and your remote working areas, because you're only really clean when you arrive. You should enter the virtual working area. You may then proceed to a clinical area, but you must not return to a working area to maintain that virtual working area as a COVID-free zone. You should set up strict cleaning protocols to make sure everyone is cleaning the tablets with Clinell wipes or other equivalents, as well as all the computing equipment. You should be very closely liaising with your IT team to open up your Wi-Fi bandwidth and access. You'll find there are probably restrictions in place that you need to overcome. And a key point is to get buy-in from the whole team, including some of the less tech savvy or more tech phobic members. Those might be the members who are perhaps slightly more senior and actually have the most to gain by staying away from the shop floor and actually the most to gain from working remotely. And finally, just an example of how it's worked for us, we have a setup with the consultant, Dr. Carla Plyman, here working remotely, with our registrar, Nickel, here on the wards donning his PPE, about to go and see a patient, and Angela, one of our ANPs, who's documenting and helping out with the ward round completely remotely. So there's only one member of the team who's actually patient facing, and we've got other members of the team contributing from their virtual environment.